Hi, this is Sheila, the pediatric nurse practitioner with our orthopedic department here at Brenner Children's Hospital. I hope that I've had the chance to meet your family during your hospital stay, but if I haven't, I sincerely hope that your child is recovering well after their spinal fusion surgery. We know that being in the hospital is a stressful time for families and children. You haven't slept, you're getting a lot of information, and so we wanted to create a resource that you can have at home that answers most of the common things that you need to know to be able to take care of your child after this procedure. Please know that our team is here for you, and so if there's anything that's not covered that comes up, please reach out to our clinic. You can give us a call or send us a message through your MyWake Health. I like to start this conversation out with kids to kind of reassure you that I promise things will get better. I know these last couple of days have felt rough, and really the first 2 weeks are the hardest, and then things continue to improve. Every day will get better from here, but if you can make it through the next 2 weeks, I promise you'll start to feel like a new human again with a straighter spine and maybe a little bit taller. So a couple of things that we talk about when kids go home after this surgery is that any kid who's had it done tells us the more they move, the better they feel. And part of that is because we have realigned their spine, which means that we've also realigned all of the muscles in the back. We've taken some that were short and stretched them out. We've taken others that were long and shortened them and kind of compressed everything down. And so the more that your child walks, the better and more comfortable that they're going to feel, because it's going to allow those muscles to start to balance out in their back after this surgery. Keep in mind, this is not long walks. This is short, frequent ones. As Ms. Sybil has already told you before, our goal is to walk a total of 1 mile throughout the day in those short, frequent segments. You'll find that your kid likely will get up in the morning, have some breakfast, take a walk, maybe work on an activity, take a nap, and then kind of repeat that through the day. All of that extra sleep is okay. Their body is using lots of extra energy to heal itself, and so please know that that's okay. It's to be expected, but when they are up, we do recommend getting in those walks. If your child doesn't walk at baseline, that's okay. We still recommend getting them back to their chairs, back to their normal activities as soon as they can tolerate this. All of this walking not only helps comfort in regards to the muscles in your spine, but it's also very important for other complications that can occur after surgery, such as lung issues or belly issues from not moving around. So if there's one thing that you take away from this, again, please encourage that your child move, which will continue to help make them more and more comfortable. With that said, not all pain can be covered just by walking. And so we're going to make sure that your child receives the medicines that they need, similar to what they've been taking here at the hospital. So their baseline level of comfort that we recommend is that you're going to rotate Tylenol and Motrin around the clock. So it'll be Tylenol, 3 hours later, Motrin, 3 hours after that, Tylenol again. We're going to make sure that you have your child's correct dosages on your discharge paperwork based on their weight. If you need something above and beyond that, you'll also be sent home with oxycodone, which is a narcotic pain medicine designed specifically for postoperative pain and bone pain. And then also you'll be sent home with Valium, which is a muscle relaxer. I find that most kids like the oxycodone during the day because they're up and more active and it's true surgical site pain that they're experiencing. And then they like the Valium at night because if you think about it, we're typically making some short, frequent movements throughout the day or through the evening while we sleep. And so their body is going to try to guard and protect itself. And so as they hold their body stiff, things get tighter, tighter, and tighter, and then they wake up in a spasm. But you'll find what works best for your child. We do ask that you start to wean those medications as soon as they can tolerate it. You can start by spacing out how long in between each dose and then switch to half doses as needed from there. We can send a 5-day supply of the oxycodone and the Valium at any time per North Carolina law. And so it's not uncommon to need at least one refill for each of these medicines. So if you need something, please give us about 24 to 48 hours of notice beforehand. I like for kids to stop the oxycodone first, then the Valium, and then once they're off both of those medications, then you can start to wean down the Tylenol and Motrin to just as needed. Next up, we like to talk about your child's incision and how to care for it and what to look for. So as you've already seen, there is a clear strip of Dermabond that goes across their back. This is going to stay in place for 3 weeks. At the 3-week mark, this can come off. You'll just start by peeling it down slowly. If it's extra sticky, then you can use some Vaseline to help soften and help this remove over that time period in the 3 weeks. If it starts to peel before then, which is possible, it could get caught on clothing and kind of tug and create some discomfort. So you can just trim down the edges at the top where it's peeled down. We want to make sure that the incision stays nice and dry. And so this product, like we've talked about, is sticky. Some kids do not like the sensation of their shirts sticking to the Dermabond. And so if this is a concern for them, then you can do some gauze strips down the back with some paper tape, only if it can stay dry. So if you've got an extra sweaty teenager, we do recommend to not use any gauze, but as long as it stays dry, then you can use that as a barrier as needed. At this point, your child can resume normal showers. We do not recommend any soaking, such as pools or bathtubs, but you can let soap and water run over the incision. We actually really like that. And then when they get out of the shower, you'll just pat everything nice and dry. You want to make sure that their incision stays nice and close together, that there's no areas of gapping, no redness, drainage, or swelling and heat around the incision. If any of that's going on, please give our office a call. In regards to showers and care of the incision, hopefully your child has already had a chance to practice taking a shower here at the hospital. But if not, a couple of things that we have heard along the way that are helpful, particularly depend on what kind of shower that you have. So if you have a walk-in shower, this is easiest for your child to walk straight into. But if you have a tub shower, most kids have found that they like to sit on the side of the tub, swing their legs in, and then stand from there versus trying to step over the tub all at once. Your child probably will need something to sit on just from a stamina perspective after the surgery. And so you can pick up a shower chair at any local pharmacy, Walgreens, CVS, Walmart. You can order one off Amazon if need be. Other people have chosen to use things like plastic lawn chairs or buckets that can get wet. Our only recommendation is if you choose this method, please put something in the bottom and assist your child so that that product doesn't slide across the tub and cause them to take a fall. In regards to warm water and then also the pain, the other thing I like for families to know is that you can use some warm compresses over your child's incision or ice to help make them comfortable. Just please make sure again that no moisture is sitting directly on the incision for long periods of time, and please do not use any type of heating pad. The skin on either side of their incision is going to be fairly numb, and so we have had issues in the past where a child has left a heating pad on and it caused a burn because they couldn't feel that against their skin. So just a couple things to be mindful of. Next, I like to kind of talk a little bit about belly issues, nutrition, and fluids. So all kids keep a little bit of a lower blood pressure in their teenage years. Your child's also had surgery and lost some level of blood, and then they are on medicines, all of which lower their blood pressure as well. And so we recommend that they drink lots and lots and lots of hydrating fluids over the next couple of weeks. Try to avoid things with lots of caffeine or that could dehydrate you, so things like teas and sodas, and really shoot for the waters and Gatorades and clear beverages that will help keep them hydrated. This not only helps their blood pressure, but it helps with things like constipation as well, to make sure that they're nice and hydrated. Your child might have had some dizziness here in the hospital, especially with transition from sitting to standing. So as a reminder, make those transitions slow. Remind them to take a moment for a couple of seconds before they move forward. And that's the reason that we ask for you to be home and to help them for the next couple of weeks as they're moving around, because as you make that sudden transition, they could have a dip in their blood pressure that causes them to pass out. In the event that your child does pass out, just slowly lower them to the floor, elevate their legs, and within a couple of seconds, they should be awake again. And again, remember, lots of good fluids, slow transitions will all help this. In addition to the pain medicines dropping your blood pressure, they can also make you constipated. And so you're going to continue to receive the Miralax and the stool softener that you've received at the hospital. Lots of good fruits and veggies, lots of fluids, lots of walking. All of these things are going to help keep your child's belly from moving and help with constipation. If, however, your child is having a difficult time despite all of those things, you can, in those instances, mix their Miralax into some type of warm sugary beverage. So if they like coffee, hot chocolate, apple cider, these are great options to help stimulate to get the bowel to move. And we'll give you some other tips and resources in your discharge paperwork, but most of the time that's enough to keep things going. Your child needs lots of extra protein and calories over the next couple of weeks while their incision and their spine heals. So even if their appetite is down a little bit, which is common, please really work towards getting lots of protein and calories. Not every kid will enjoy a meal replacement like a Boost or an Ensure or a protein shake, but a lot of them will take that as a base for something like a milkshake or a smoothie. And so you might have to get a little creative how to get that into them. But again, really encourage some small frequent meals to help everything heal up and give them the energy that their body needs. And then lastly, we just kind of like to let you know, when do you need to call the clinic and what kinds of things do you need to watch out for? So physical therapy has already kind of talked to you about your restrictions. So those are no bending, lifting, and twisting for the next 6 weeks. I also like to discuss if you're old enough to drive, we do not recommend or clear you to drive until after you see Dr. Freno for your post-op appointment or Dr. Hughes. We expect that your child might have a little bit of fever for the first couple of days because this is a big inflammatory response with this surgery. That fever should always come down with Tylenol and Motrin, and it should not be associated with any pain, swelling, or drainage of the incision. If after, say, 72 hours, your child develops a new fever that they previously hadn't had, they have redness, drainage, swelling, or increased pain, then those would all be reasons to give us a call to clinic. If, however, they're comfortable, their incision looks good, but they have cough, cold, belly issues, and that's still going to be your pediatrician, just like it was before. Other things that would warrant a call to clinic would be pain that's suddenly no longer controlled by the medicine that they've been taking, or if your child is experiencing any changes to the feeling or movement of their legs and toes. If any of that's going on, please don't hesitate to reach out to our clinic. Our nurses are here Monday through Friday, 8 to 5. They are all wonderful and great resources, but if they can't answer your question, they have direct access to our team at all times. And they're really good about calling you back same business day. However, we do have a dedicated triage department. So if you need to speak to someone urgently, there's always someone available for that. And our telephone number, which you're going to get on your discharge paperwork, and I'll give you here as well, will also get you to the triage line for the hospital if you have questions after hours. So please, again, do not hesitate to reach out to us at any point. Our team is here. We are happy to help make sure that your child recovers well after such a big surgery. Our telephone number here in clinic is 336-716-8094. And again, if you have MyWake Health, then that's a great option to send us a quick email as well in a secure method. If you don't have that and want to get signed up, just let your nurse know and we will help get that arranged for you. Again, I wish you the best recovery after your spinal fusion, and we'll see you in a couple weeks in clinic.